Hello, my name is Jacob Bingman, and this is going to be my persuasion speech for my CST 100 class. The definition of female genital mutilation, or better known as FGM, as told by forwarduk.org, is a process of partial or total removal of the external female genitalia or injury to the female genitals with no medical reasoning. Per UNICEF, it is also a violation of girls' and women's human rights. The practice of female genital mutilation is practiced in multiple countries around the world today. It can be done as a cultural or ceremonial reason or even religious reasons. Today, I'll be telling you some statistics about female genital mutilation from around the world, what are the reasons behind it, the effects, and why it should be stopped. As written in Female Genital Mutilation, written by UNICEF, and sponsored by WHO, that a total of over 200 million women around the world have been cut in over 30 countries. The definition of cut or cutting is undergoing female circumcision. And female circumcision is the process of going through some type of female genital mutilation. Also, per new statistical report on female genital mutilation shows harmful practice is a global concern, which is also written by UNICEF, that there is at least 44 million girls of the age of 14 or younger that have been subjected to the process of genital mutilation. Female genital mutilation is prominent in two areas around the world. These areas are in countries in Africa and in the Middle East. Most people wonder when hearing about FGM that where did it originate from? Per UNFPA in their article, Female Genital Mutilation, FGM frequently asked questions, that there is no clear origin of the practice of female circumcision, but there is evidence that it predates past the rise of Christianity and Islam. And then also there is evidence due to some mummies that also show signs of FGM in Egypt. Also, Herodotus claimed that during the 5th century BC, that many groups such as the Phoenicians, the Hittites, and the Ethiopians had been practicing female circumcision. Also, in the most recent time, in the past few decades, since the 1950s, female circumcision has been practiced in Europe and the United States for things such as hysteria, epilepsy, mental disorders, masturbation, nymphomania, and melancholia. A big question people have is female genitalization a part of a certain religion, and is it required? As said by UNFPA, also in their article, Female Genital Mutilation, FGM, Frequently Asked Questions, there is no religion that says that it is necessary. Also, no religion requires or condones FGM. But there are still many religious groups around the world that do practice FGM. Most people see and think that FGM is connected with Islamic faith, but it is not a part of the religion as a whole. Only certain groups do practice it. There are also many non-Islamic groups that do practice FGM. Some examples are certain Christian groups, Ethiopian Jews, and others who follow a traditional African faith. Now to talk about the effects that FGM have on women mentally and physically. Firstly, the way you are affected by FGM is all related to the type of FGM you have been affected by. There are 4 types of FGM. Per End FGM in their article, What is FGM? Type 1 is also referred to as clitoridorectomy. Type 1 is based around partial or total removal of the clitoris and its prepuce. Type 2 is also known as excision. This is when the clitoris and the labia minora are partially or completely removed with or without excision of the labia minora. Type 3 is known as the most brutal and severe form of FGM. It is called infibulation or the pharaonic type. It entails narrowing of the vaginal orifice with the creation of a covering seal by cutting and positioning the labia minora and or the labia majora with or without removing the clitoris. Then the edges are stitched together for a period of time to create a covering seal. In other words, a female's legs are completely bound and put and closed together. There is a small opening left for urination in women's menstrual cycles. The only way to open the seal is through sexual intercourse or surgery. Type 4 is an umbrella category. It is everything that is not mentioned in the first 3 types. Things such as pricking, piercing, incising, and scraping. There are many consequences of FGM. Most of them are immediate. There is agonizing and severe pain, bleeding, shock, difficulty to urinate, infections, and other genital tissues being injured, and sometimes even death. Death can be a result due to severe bleeding, which leads to hemorrhagic shock, neurogenic shock, which is also due to the trauma, and terrible infections and septicemia. The event of the procedure itself is very traumatic for the girls that must endure it. They are held down by force during the procedure. The risk of complications skyrocket with the type of cutting that is being performed, and the most severe and prevalent with infibulations, which is also again known as type 3. Now I'm going to talk more about the mental effects of FGM and what it has on women. FGM has a huge psychological impact on a woman, causing anxiety and PTSD, also known as post-traumatic stress disorder. Per David Adam in his article, The Mental and Emotional Effects of Female Genital Cutting, the psychological effects of FGM has on a woman are tremendous. During experiences like childbirth and sexual interactions cause further distress to the FGM victim. Countless amounts of women die a year due to FGM. This is something that must be stopped to help all women who are being subjected to this terrible practice. There's a risk that at least 3 million girls are going FGM under a year, and that is per FGM Genital Mutilation by Who. Also, shown on a graph provided by Laura Raymond in her article Female Genital Mutilation, the facts, that in 1991, 1,222 women had undergone some form of FGM and were surveyed through 4 different Kenyan districts. 48.5% of those women had experienced some type of hemorrhaging, 23.9% of them had infection issues, and 19.4% had urine retention at the time of that FGM procedure. We do need to put a stop to end FGM mutilation around the world today.